for having me, Mark. There's some of those publications that I forgot I even contributed to, so
There you go.
that was well done, my friend.
Nicely done. Well, listen, before we kick things off, can you give folks a little bit more background? How did you get into the nutrition field and working with precision nutrition?
Yeah, I mean, funny enough, I actually started my college career as an engineering major. I was an engineering major for 3 years before I finally switched to nutrition, even though I spent way more time learning about training and nutrition than doing my engineering work.
Nice.
Um, yeah. That's how it goes sometimes. And so then I actually started my career as a strength and conditioning coach at Cressy Sports Performance with Eric Cressy. I was like one of the first interns, the first employee there. So that was a great like launching pad for my career. I learned a ton from Eric.
Awesome.
Went back to school for my master's in nutrition and to become a registered dietitian. And during that process, PN, I've been a part of their, a subscriber to their newsletter list since like day one before PN was even founded, looking at johnberardi.com.
Yeah.
They sent out an email they were looking to hire coaches. Like at this point it was called Lean Eating. Now we call it PN Coaching. So they're looking to hire some coaches. And I had always planned on starting my own facility and doing a lot of nutrition coaching and training. But I figured, what the hell, I'll apply. Worst that'll happen is I don't get it, and I just do what I was going to do anyway. Best that happens is I get an opportunity to work for, Dr. Berardi, JB, who was one of the reasons I got into the field in the first place. And I was fortunate enough, out of like 300 people that applied, they hired myself and another guy. And I've been at PN ever since, about 5.5 years at this point.
That's awesome. Yeah, it's amazing how those little moments in life, whether it's following your passion with getting into nutrition and training or things like that, that really start to dovetail careers and everything else. That's a really cool story. And of course, today we're going to jump into talking all about vitamin D. It's cold out, it's dark out, it's winter time. So we'll talk about the sunshine vitamin here. And apparently almost 80% of the population is insufficient in vitamin D. So can you give listeners a little bit of insight into why vitamin D is so important for health?
I mean, vitamin D I'd say part of the reason why it's so important is it's not even really a vitamin. It functions almost more like a hormone in the human body, and it contributes to so many facets of health. It contributes to performance, it contributes to immune function, it contributes to energy levels. I mean, without enough vitamin D, it contributes to bone health. I mean, without enough vitamin D, lots of things can go wrong. So it plays a big role, and it's especially important for those of us who live like in the Toronto area like yourself, or in the northeast of the US like me, where this time of year up until, depends on where you live exactly, but April, maybe even May, you can't even produce vitamin D from the sun. And so it's super important to be cognizant of what your levels are, and it's hard to get in food. So I think there's a lot of different reasons why it's helpful to be aware of what your levels are and recognize that it plays a role in so many bodily functions, from really small things or small in terms of like drilling down, like your parathyroid hormone, versus just bigger perspective things like cancer and immunity, bone health, all kinds of things of that nature. So it plays a role in a lot of different areas of the body.
Yeah, it's so well said because, again, as you mentioned, vitamins are things that we just can't synthesize in the body, where vitamin D, we can synthesize, and it acts more like a hormone, a corticosteroid, and affecting all these different tissues of the body. And you mentioned there about, not being able to produce it. Now, if someone's standing outside New York or Toronto or London, the UK, between sort of November, February, March, are they going to get any vitamin D if they're standing out there in the sun for 15, 20 minutes?
Nope, not really. You could be there stark naked, and it's just the angle of the rays of the sun make it very difficult to produce any significant amounts of vitamin D. Whereas if you're living around the equator, the angle of the sun doesn't really make any difference year round for the most part, nothing significant. So if you live in those more northerly latitudes, you can't really produce vitamin D from. It depends on exactly where you live, but yeah, November, December, January, February, at least. Oftentimes October, March, and April even can be challenging times depending on where you are. So it's super important, particularly in those areas. But you even find what's interesting about that is you look at people who live in like Florida in the US or in southerly regions, their vitamin D levels aren't necessarily substantially higher. than people who live in more northern latitudes. I mean, they might be higher in like the winter time if you're comparing apples to oranges, but year round, or apples to apples, but year round, that you see a lot of people who still have insufficient levels, even if they live in areas where they should be able to produce adequate vitamin D from sun exposure.
Yeah, it's definitely one of those things where the scare of melanomas and skin cancers and things, and of course, a lot of the research coming out of Australia, a few decades ago with sort of a transplanted British population in the hottest place, one of the hottest places on the planet, wasn't the most ideal. And of course, now you had lots of, even in the UK, I think even a few years ago, there was, rickets was almost starting to make a little bit of a comeback because people were so much sunscreen outside, so much fear of people getting sun. So yeah, in the summertime, how does things like sunscreen even impact our ability to absorb vitamin D?
Well, I mean, I'll preface this with sunscreen is important, and people should not neglect to wearing sunscreen because developing melanoma is not something that you want if you can avoid it.
For sure,
So
for sure.
I think too often sometimes you get people who are big vitamin D proponents who are like, in my opinion, just too far down the spectrum in terms of like anti-sunscreen. I think there's reasonable usage, right? So I think the best way I can put it is, let's say I walk my dog most days of the week, especially in the summertime when it's nice, a little more challenging this time of year in Maine where I live. But I'll take her for like a 20, 25-minute walk. I don't wear sunscreen on that walk. I'm not getting a significantly long enough sun exposure where I'm increasing risk of like being burned, and I'm not exposing a ton of my skin. I try not to walk her during like the really peak sun times, like 10 a.m. to 2 p.m. So I walk her usually in the morning when it's not super hot, but I get some nice sunshine. And also I feel like just from a general health perspective, there's some other interesting data, not even related to vitamin D, but sun exposure can help improve your circadian rhythm, can decrease blood pressure, like some really cool stuff, in terms of getting some sun exposure. But now if you're going to and you'll produce, depends on the individual, but you can produce 5, 10, 15, up to even I think 20,000 IUs, so long as you're exposing enough skin in that 15, 20, 25 minutes of sun exposure. And that's plenty. That's plenty of vitamin D, more than you need to help get adequate blood levels. But I think where people can get into trouble is like never wearing sunscreen, or thinking, oh, if 20 minutes of sun exposure is good for vitamin D production, then 40 minutes is better, or an hour is better. And that's actually not true. Up to a certain point, after about that 20 to 30 minutes, your body will actually stop producing further vitamin D. So you're not actually getting any extra benefit, and now you're significantly increasing risk of getting burned, which increases risk of skin cancer and whatnot. And so, but sunscreen, especially the ones that block UVB rays, block vitamin D production. So when you wear sunscreen every time you go outdoors, if you're one of those people who's always following, some like these dermatologists recommend it, to decrease aging and things of that nature, constantly wearing SPF, constantly wearing sunscreen, particularly ones that block UVB rays, you are not going to be producing vitamin D. So you're increasing your risk of being vitamin D insufficient or even vitamin D deficient for sure.
Absolutely. Well, a couple great points there. One of them is people going on holiday, they don't need to spend 4 or 5 hours in the sun, do they, to get their vitamin D? That's a very good point. And of course, with the sunscreen for sure, definitely areas where there's a lot of thin skin as well around the nose and the forehead and these areas, like especially the hottest parts of the day. So that's definitely good to clarify for folks. Now, what about people with darker skin complexion? Are they going to need to be out there longer to be able to get sufficient amounts of vitamin D?
Yeah, it's really interesting. People who are darker skin, it is harder for them to produce vitamin D from the sun, and that's probably, in theory, like an evolutionary thing, right? I mean, it's kind of the thought process there. But yes, people who have darker skin, it does take more sun exposure to produce as much vitamin D as someone who's lighter skinned. And there's lots of competing theories as to why that is, or if people who have darker skin need blood levels as high. There's all kinds of discussion going on there. I don't know if anybody quite truly knows, but what we do know is that it takes more time, increased sun exposure. So, but people who have darker skin, it may not always seem this way, but you're still at risk of getting a sunburn. So it's one of those things where you still have to balance, like, okay, it takes a little more time to get my vitamin D get my vitamin D production, but there's still a point of diminishing returns where you can still get a sunburn or still increase your risk of developing skin cancer. So instead of maybe 20 to 30 minutes, it's probably 30 to 45 minutes or somewhere in that range to get that vitamin D production. But I would still be mindful of not having the mindset of, well, if some is good, then more is always better.
For
That's
sure.
what gets people into trouble.
The all day session you got to be
Yes,
be
right,
mindful of.
right.
Now, obviously, the sun is the best place to get vitamin D. What about vitamin D in foods? What's the difference between plant foods and animal foods when it comes to vitamin D?
Yeah, I mean, what's interesting is like there aren't a lot of food sources of vitamin D, right? There's, fish, particularly like fish organs. That's where like cod liver oil is famous for its vitamin D. Eggs contain some. Mushroom contains some. That's pretty much about it. I mean,
Yeah.
some other shellfish, maybe, and a little bit of seafood, but it's not a whole lot. And so what you do often get from maybe like mushrooms is usually like vitamin D2, though there are some interesting things now where they're like expose them to I can't think of the term off the top of my head. Some type of light. I'm drawing a blank. But they expose them to a certain amount of light, and it'll actually produce some D3 as well in the mushrooms, which is really interesting.
Awesome.
But for the most part, you're going to get some vitamin D3 from food sources, but it's relatively minimal. Of course, they also add vitamin D to dairy, to a lot of dairy options, and that was done to help prevent rickets and things that were common in the developing world, and even in industrialized countries in like the early 1900s, mid 1900s, in that time period. So that's where you can get it. It's in some fortified foods as well, but it's not naturally occurring in a lot of foods.
Yeah, it becomes a bit of a misnomer, doesn't it? That idea of vitamin D rich foods. It's sort of
Yeah.
of anything that has a little bit, but it's still a pretty sparse, as you mentioned there. And of course, getting back to what our grandparents would have done with this, with using cod liver oil. I always fascinated by things that are sort of traditional, and then a couple generations later, we have all the science to show us that, hey, this cod liver oil's got the vitamin A and vitamin D and some of these factors that are going to really help us out. So, do you see more folks using that now again in their as part of their nutrition program?
A little bit. I mean, I would still say people between the two, people definitely do fish oil much more so than cod liver oil. But I definitely see more people doing cod liver oil. It's just one of those things I think you have to be a little bit more mindful of, because you can't treat it like fish oil. It's not like a one-for-one replacement. If you try to take it and get as many omega-3s as you get from fish oil, you run risk of potentially having excessive levels of vitamin A and sometimes even vitamin D. So, but I think in small amounts, a teaspoon, 1 to 2 teaspoons a day, there can be a ton of value, because you're getting more than just the omega-3s you're getting from fish oil, right? You're actually getting a vitamin D rich food for the most part, or supplement, whatever you want to classify it as, along with vitamin A, which is important. I think what's oftentimes lost in some of the massive vitamin D supplementation is that a lot of the fat soluble vitamins work kind of in concert. So if you're taking a ton of vitamin D of your own accord, if you're doing it under medical supervision to treat a deficiency, that's one thing. But if you're taking high levels of vitamin D, 5,000 IUs a day, 10,000 IUs a day, like you see some folks taking, and you're not ensuring that you're getting adequate amounts of vitamin A or even vitamin K2, which is a particular type of vitamin K, there is some evidence that suggests you could be, yes, getting benefit from the vitamin D, but also having some unintended consequences by high dosing the D and not getting in enough A and K.
Yeah, it's definitely one of those ones. That's a great point where, the lower your vitamin A status, you're definitely at risk for more toxic effects from the vitamin D. So you've got to watch that.
Right.
And that's definitely something that a few years ago, if we stay on the kind of the supplement route here, is that, people seem to be supplementing with high doses of vitamin D, 10,000 IU a day or more for months and months on end. And of course, you touched on some of the pitfalls there. Any other things that people should be concerned about with toxicity or side effects if they were to take big doses for long periods of time?
Yeah, I mean, one of those. This is just kind of my general philosophy when it comes to supplements in general. You should also always have the principle of do no harm, right? And so
Sure.
yes, and I think something sometimes that's easily forgotten in
Absolutely.
the quest for optimization.
Yeah.
Right, and sometimes the research just doesn't show us the full picture yet, especially when something is relatively new on the scene, like vitamin D was a handful of years ago or so. People just kind of went a little too far in terms of on the pendulum, right? People weren't having any vitamin D, taking any vitamin D for long periods of time other than what might have been in their multivitamin. And then all of a sudden, maybe about 10 years ago, we became more aware of the importance of vitamin D. People started supplementing like crazy, right? Taking 5,000, 10,000 IUs when they didn't every day, when they didn't even know what their baseline blood levels were to begin with. and we just didn't have that much data on the whole, right? We had a flashlight on a small piece of the puzzle, and we didn't see the full puzzle yet. So I think that's one of the things. I'm always cautious when it comes to stuff like that, because we don't know what we don't know, and there's only so many questions that have been asked and explored. And so I tend to just have a more cautious approach in general. And because we always discover things in hindsight, and it's like, oh, well, I wish we had realized that when your vitamin A status is low, right, you increase risk of toxicity from vitamin D. Even if we're taking the same amount, you and I, if our vitamin A statuses are very different, that can affect how that supplemental vitamin D affects us. And so I think it's important to always keep that in mind, and to kind of always have the do no harm principle. Because when you look at some of the other research on vitamin D, and a lot of it is observational, it's not necessarily known cause and effect, but there's some pretty consistent observational evidence that once blood levels get above maybe like 40 to 50 nanograms per ml, there is consistent increases, small increases, but increases in risk of mortality, which I find really interesting. And we're talking associations. This doesn't prove anything. But you look at the vast majority of the vitamin D evidence, and it shows that most benefit comes from helping people not be insufficient or deficient. Once you're kind of above that threshold, you're maximizing most of the benefits and minimizing risk. And there are times and places to have much higher levels in certain circumstances. But I think oftentimes people kind of misapply that. Well, if someone who has cancer should have really high levels of vitamin D to help with their treatment, then I'm going to have really high levels all the time because I think it might help me prevent cancer. We don't know that's the case, right? Just because it's important or helpful during a certain circumstance doesn't mean it's going to be helpful all the time. And it might have some unintended consequences that we're not aware of. So I tend to be, where can I maximize benefit, minimize possible unintended consequences, so I do no harm with myself and with clients who ask about it. And then if they have a medical need, or there's some other interesting particular circumstances that they have where they might want to have it higher, I might give them information to discuss with their medical team. But I'm a big advocate of, it's a long-winded way of saying do no harm, be more cautious, and then only increase as necessary.
Absolutely. I mean, that idea of context is one that you mentioned there. And it gets so lost all the time if people pick a certain scenario and see a certain dose or an exercise or whatever it may be, and then apply it to a different situation, just like for like, when it's just not the case. And you mentioned things like insufficiency. And of course, the Endocrine Society committee classifies that. We'll just do some Canadian and American numbers here, sort of, less than 30 nanograms per mil in the US, and of course, less than 75 nanomoles per liter. So if people are getting tested, that's kind of those areas to shoot for. And as you mentioned, getting up beyond that 40 is definitely one where we start to see some potentially bad things going on. And ironically, the normal range even goes up on the labs here in Canada, would go up to 250 nanomoles per liter, which is far above that. So,
wow.
So even they're slow to change. So it's not always the good.
Well, and part of it, I think it's the evidence isn't necessarily clear, right? We don't quite know, because that was based on observational data.
For sure.
It's not like we've been giving people really high doses and then seeing if they die. That's not usually how research is done, just for ethical purposes. Unless it's like a preventive measure, like a statin, where you're trying to see if you can prevent deaths. So it's one of those things where there's probably not enough evidence that says, man, going higher than 40 definitely increases your risk. But there's definitely enough data that would just make me take pause and consider the cost to benefit ratio for myself and for my clients. All right. And so that cost to benefit ratio changes depending, like you said, on context. So if I'm just looking to get healthier, I'm already generally healthy, I'm just looking to be fit and make sure I'm not insufficient, then there's no need for me to crank it up to 250 nanomoles per liter. Right. That's probably not going to give me any more benefit for that goal than just being I'm trying to think of your numbers, so about 75 to probably like 100 nanomoles per liter.
Yep.
In that 30 to 40 nanograms per ml range. I think that's probably in that 30 to 50 nanograms per milliliter, or what does that translate to? About 75 to
150 or so, yeah.
25. in that ballpark. That's what I would generally consider to be like a pretty safe place to be in. Oftentimes you see it's a little higher in the summer because you might still be taking some vitamin D and getting some sunshine, and it might come down a little bit in the winter when you're really just taking it supplementally and whenever you get through your diet. But as long as you're, I think, in that range, you're probably in the do no harm, maximizing the benefit space for the most part. But again, there can be medical times and places where it should be higher, but that's not going to come from suggestions from me because I would consider that outside my scope of practice. Now, I might give a client information to discuss with their doctor about it if I think it might be valuable because of things I've read and research I've looked at, but it wouldn't be my call, right? And I would make sure they discuss that with their medical team.
Absolutely, yeah, great advice there. And we talked about various ranges, and if we shift gears here and talk athletes, a few years back with a lot of the meta-analyses and reviews coming out with potentially showing things like VO2 max and recovery and force and power production, all these incredible potential benefits around vitamin D. Of course, now in 2017, we're seeing a little bit less overall sort of euphoria around this. Can you give us a bit of an update on what some of the benefits could be for athletes and where things stand?
Yeah, it's really interesting that you say that because to me, when I look at the data, it actually it looks pretty similar from my perspective, like what we saw earlier and what we see now. But I think how the lens they looked at the results differed. And it's kind of like fish oil in some ways, where, for a long time people were like, wow, fish oil is amazing for heart health. Well, that was mostly true in people who had really insufficient amounts of omega-3s, and we didn't have the more advanced anti-inflammatory statins we had today, because fish oil has some anti-inflammatory components. So when people took fish oil, it caused some pretty cool benefits. Now you see in some of the more recent data with fish oil, if they combine it with an anti-inflammatory statin, they see no extra benefits, therefore they determine that fish oil is not beneficial. It's like, well, no, that's not really true. Maybe it's not beneficial in conjunction with that medication because that medication is giving most of the benefit. But from other health perspectives, there's plenty of other benefit. And it's the same thing to me with vitamin D. When you looked at some of the older research, it was in people who were often had very low levels of vitamin D. Right, so you give them a bunch of vitamin D, you bring their levels up into those healthy ranges outside of that insufficient or deficient range, and bam, you see all these markers of performance improve. But when you give vitamin D those same levels, same amounts to someone who's already above that threshold, you don't see significant performance enhancement because there's a point of diminishing returns. Right, it would be like protein or creatine or anything else of that nature. If someone's already taking 5 grams of creatine a day, we've already maximized their creatine stores. If I give them an extra 5 or 10 grams every day, it's not going to give them any extra performance benefit. Right? We've already maxed out the benefit of creatine. And I think vitamin D kind of fell into the same category, but we didn't have a lot of the baseline data that we have today. And so I think you look at the research, and in my opinion, what it generally shows is if someone is deficient or insufficient in vitamin D, giving them supplemental vitamin D can improve their health, their immune function, their performance without question. But if someone's already in that healthy range, if they're already above 75 nanomoles per liter or 30 nanograms per ml, taking more vitamin D probably won't give them a lot more extra benefit. So that's kind of where I feel things stand. And part of that's probably also colored. I mean, we all try to be as objective as possible. We all have some internal, biases, and that's probably colored by my philosophy of do no harm. But when I look at the research, that's how I interpret the difference that you see today versus, maybe 10 years ago or further back on the performance enhancements of vitamin D supplementation.
Yeah, no, that's really well said in terms of those parallels, especially with omega-3s and fish oils and that idea of taking deficient and insufficient clients or athletes and seeing some of these gains. And one of the things that we definitely see at Canada Basketball is some athletes will get their levels checked. We'll be prescribing them vitamin D, and then the levels just will really refuse to budge even at different doses. And so it's sometimes, and even in folks who are coming in for general health, maybe they got a lot of abdominal adiposity, their blood sugars are higher, there's a lot of inflammation. We see this sort of consistent sort of low level. Can you talk a bit about some of the kind of root causes of what could be driving vitamin D down versus just a need for more of that of sun or vitamin D from food?
Sure. I mean, we do know, the more body fat you have, the more it kind of like what's another right word, kind of almost steals vitamin D, right? Because vitamin D can kind of be stored in body fat, and then it's kind of almost removed from your blood, right? So your blood levels are actually lower. So having obesity can kind of, maybe not artificially, but it will increase your risk of being vitamin D deficient. So I think that's important to recognize. And then there are some other metabolic differences in terms of like diabetes or things of that nature that can also impact vitamin D status. The exact mechanisms are kind of outside my area of expertise, but it's just something as a nutrition coach or as a practitioner of any sort to be mindful of. That it's usually you have that rule of thumb where every 100 IUs of vitamin D is going to boost your blood levels by about 1 nanogram per ml or 2.5 nanomoles per liter. But that is just a general rule of thumb, right? That does not apply equally across different populations. And that kind of goes back to the context we talked about, right? You look at some of the research and it's, well, in this particular population, X, Y, and Z happens. But you can't then extrapolate that out to everybody because different populations are going to respond differently. So we know people who have obesity are going to respond differently. Their blood levels of vitamin D are going to be lower. They're not going to respond as well to supplementation. They often need to take more than that rule of thumb would have you to believe for various reasons. And so I think that's always important to keep in mind.
Yeah, I love that idea of even generalities or rules of thumbs, and especially with things like vitamin D. Is that something for you and your clients or athletes, a very seasonal thing in terms of bringing it in and taking it out, or how does that work?
Yeah, I mean, I think like probably the best way I can describe it is what I personally do. So in like the winter months, I mean, the multivitamin that I take has about 1,600 IUs. So I take that year round. So that gives me a pretty good baseline. In the summer months, I know I'm getting plenty, plus I'm walking my dog, and I would go to the beach and or go to the lake. So I get plenty of sun exposure and wear reasonable amounts of sunscreen, and I've got my blood levels tested. In the winter months, I take an extra, what does it come out to? Like 4,000 or 6,000 IUs per week. So I take like a 2,000 IU pill, like usually like twice, 2 more times a week, just to help make sure, because I'm not getting that same sun exposure, just to help make sure I stay above that 30 nanograms per ml or 75 nanomoles per liter. And it's kind of the same idea with clients that do get it tested. Now, not all of my nutrition coaching clients, which are many, get their vitamin D levels tested all the time and are discussing it with me. But the ones who do and are curious and want feedback and insight to discuss with their medical team if need be, or just for general health preventive purposes, I generally, again, a rule of thumb, but of course it always depends on the actual client, recommend if they are going to supplement, they do supplement in the wintertime, and they don't necessarily need to supplement in the summertime if they're getting adequate sun exposure, which would be 20 to 30 minutes, I would say 4 to 5 days a week in that ballpark. And also having that confirmed with testing. If they're going to get their yearly physical, making sure they get their vitamin D tested. Most primary care physicians, at least where I'm from and the people I work with, I would say test it these days.
For sure.
But if your doctor doesn't, it's not an expensive test to have them add on. A lot of insurance companies in the U.S. are now covering the cost of the test. So it's definitely something to chat with your doctor about if you've never had it tested. So you have a baseline to work from, because your number this time of year will be different than if you took the number in, say, March, when you've had a whole winter without sun exposure where your levels will drop. So it might actually be in your best interest to kind of get it measured at the end of winter when your levels will be lowest, to see where you stand after a whole winter, whether you were supplementing or not, to see, even if you were supplementing, man, I'm still low, right? So I think that can be really helpful, and maybe even get it a couple times a year in the beginning until you get a good feel for what works for you, what you respond to, and then test it yearly from there, and then always kind of adjust as needed based on actual results.
Yeah, that's a great point there as well. So, that 2 to 3 week half-life, serum half-life of vitamin D, to wait till that end of the deep dark days of winter to get it tested to see where people fall is great advice. And I know Dr. Graham Close in the UK has mentioned things that, around daily supplementation versus weekly. If it's, if you end up with the same weekly dose, you end up kind of at the same spot at the end of the day. So that's always an option for folks, almost a bit like you're doing there, of a couple thousand IU 3 times a week. But if we continue to talk immunity here, Brian, any more insights? Wintertime, cold, dark, clients catching colds and flus, things going around. If people have kids at daycares, etc., what else do you recommend on the nutrition front or movement, lifestyle, things that you tend to use with your clients?
Sure. Well, I mean, making sure that your vitamin D status is adequate. We do know vitamin D status can be really helpful for helping decreasing your risk of upper respiratory tract infections like colds, decreasing your risk potentially of even things like the flu. And then, I mean, other things in terms of other lifestyle practices would be, and this is what I always kind of hammer on, like getting those fundamentals in place. Too often I see clients and even coaches of clients really focusing on minutia. Diving down deep into details and overlooking some big fundamental pieces that would make a much bigger difference in decreasing their risk. So simple things like washing your hands frequently. I know you've probably heard it a million times, but it makes the biggest difference, particularly if you've got young kids like you and I do, where you're constantly wiping noses. Like washing your hands after that is a lifesaver. Otherwise, it's almost guaranteed you're going to catch their cold, right? Making sure you're getting an adequate protein. Protein is critical for immune function. Making sure you're getting in plenty of fruits and vegetables for all the various immune benefits they can give you. Making sure you're getting enough omega-3s, whether you're consuming fatty fish or taking some fish oil or a combination of the two, has immune boosting properties. Sleep, right? Getting enough quantity and quality of sleep, aiming for hopefully at least 7 hours of quality sleep each night. And that makes a big difference. I don't remember the exact number off the top of my head, but it's something along the lines of if you get less than 6 hours of sleep for like a couple nights in a row, it suppresses your immune system by like 40%, something along those lines.
Yeah, it's incredible, isn't it?
Crazy amount. And when you have young kids, that often isn't always within your control. But doing whatever is within your control to maximize your sleep can make a huge difference. And then stress, right? What can you do to help build stress resilience or lower what you'd call your allostatic load, like total amount of stress that you're under, whether it's just through simple breathing exercises, like doing one of the things I do, taking my dog for a walk outside most days to help de-stress. 5-10 minutes of meditation. Doesn't have to be, sitting in a quiet room with your fingers crossed and your leg in the, crisscross applesauce, as they call it today, and they don't call it Indian style like they used to when I was a kid. Probably better that way, but I mean, it doesn't have to be in that. I don't know. I think people sometimes have a misguided idea of what meditation can be, and I know I probably used to as well. But I found big benefit for myself and for a lot of clients just taking 5 or 10 minutes. Doesn't have to be a ton to decrease stress, which will also have a huge impact on your immunity. So there's many big pieces, and I think focusing on those fundamentals, making sure you're getting adequate overall good nutrition principles in place, so getting plenty of protein, plenty of fruits and vegetables, some healthy fats, making sure your vitamin D status is adequate, getting enough carbs to meet your activity needs, and then getting in, I mean, these are all obviously easier said than done, adequate amounts and quality of sleep, working on your stress as much as you can, and washing your hands. Those are your biggest rocks by far. I mean, there's all kinds of other little things you can do, drinking tea and all kinds of stuff like that. That's going to have a much lesser impact than those fundamental pieces.
Oh, I love it. That's great. I mean, that idea of big rocks is such a big component for me as well, and that just getting some of those fundamentals down. And as you mentioned there, things like even hand washing obviously is massive, and it's something that people don't tend to do anymore. They just go from the laptop to having lunch right next to the computer, and
right,
touching all sorts of surfaces and whatnot. And so that's definitely great advice. And
I think it's often overlooked, like you said. I mean,
massive.
When I was doing my dietetic internship in the hospital, like they were going through really trying to hammer down like really specific hand washing protocols, even for the doctors. Actually, the doctors were like the worst offenders. They would they'd roll into the patient's room, and like nurses had to be like really on top of it because they would get really nailed if they didn't. And as an intern, if I didn't follow protocol, man, I was going to get chewed out. But they were doing that because you look at the research and it found like when you follow these specific hand washing protocols, it decreased risk of transmission of infection by like some astronomical amount. It made a bigger difference than practically any other protocol that they would implement. And because it is that beneficial, and it is super easy to overlook, like you said, but it is fundamentally this probably the single most important thing you can do, other than like coughing into your elbow, to decrease risk of transmission of those kind of things.
Yeah, it's incredible. At the Vancouver Olympics in 2012, that was the biggest thing they were pushing, or 2010 rather. A lot of the Alpines was all about hand washing, making them wash their hands 4, 5, 6, 7 times a day.
Nothing makes a bigger difference, man. It's amazing, right? And it's so easy to overlook and to focus on like sexy, compelling ideas. So if I take this supplement, or I do, have this special sleep thing to help, like, no, man, that's going to make like a 2% difference. Where washing your hands will make decrease your risk by like 70%. Like, let me weigh the cost benefit ratio here.
For sure.
I'll wash my hands.
That shiny new toy effect is so strong, right? Now, how about you, Brian? With your work and working with clients and working with athletes, are there certain types of athletes that your clients that you work more with, or can you give folks a little bit of an insight into your day to day?
Yeah, I mean, I work with a wide variety of folks. I mean, these days, a lot of my work is with other fitness professionals. And so I probably do the majority of my work coaching other fitness professionals on, working on their coaching skills and working on their nutritional skills and things of that nature. And then a subset of my time is working with some of the elite teams and athletes that we work with. Like, we do work with the Spurs. I've worked with the Cleveland Browns historically. We've done some work with the Calgary Flames and the Maple Leafs and other teams like that. I mean, I worked with Sloane Stephens, who won the U.S. Open this past year. And so we've got plenty of athletes and teams we're working with, but there's probably no one specific area we work with more than others. I mean, historically, I worked with baseball players more than anything else, but that was simply because I started my career at Cressy Sports Performance, and they train mostly baseball players, right? So that was a product of the circumstances I was in. But we work with, and I work with a whole vast array of clients. I've worked, consulted with like Ndamukong Suh in the NFL, and I've worked with NFL teams. I've worked with NBA teams. We've worked with some NHL teams. I mean, in reality, the fundamental nutrition principles we're trying to teach to these athletes are things that apply across any sport. Yes, there are some specific minutia that's more relevant to some sports than others, but most of those athletes need to hammer home like key fundamentals before we even dive deep into some of the minutia. So I think it would be amazing for most people to see how a lot of particularly young professional athletes eat, as opposed to some of the older, more advanced guys who if they've been around for 10, 15 years, have learned that eating well is going to make a big difference in how they recover day to day and perform day to day. When you're 22, it matters less. When you're 32, it matters more at the highest level, because they play almost every single day, and it beats you down, and you need every benefit you can get. But on the whole, we work with a wide array of athletes, from Olympic athletes to MMA to tennis to team sports.
It's great to hear your emphasis there on just, I think a lot of times, even trainers or general public think that athletes have sort of a different set of rules that they play by, but to hear you say those fundamentals, definitely things that at Canada Basketball that we try to cement down. And as you mentioned, the younger they are, it is amazing what's going in and the performance that's going out. But if we could, I want to be respectful of your time here, Brian. So you mentioned you work a lot with trainers. If you had to give a piece of advice to trainers on the nutrition front, whether it's vitamin D or just nutrition in general, that sort of 20% that'll help to get them 80% of the way home and some of those big rocks, what might it be?
That's a great question. It'd be two particular things. One, it would be recognizing that people are at different points in their journey, so you can't apply what's worked for you if you're 22 or 23 or 24 to your clients maybe in very different circumstances. And this is something I learned the hard way as a young coach, and I see thousands of fitness professionals struggle with themselves, because oftentimes as fitness professionals, we're really into this stuff, right? We listen to podcasts and we go to seminars and we read blogs about eating better and maximizing our performance and our body composition and whatnot. Most of our clients aren't doing those things, right? It's just a means to an end to them. They're lawyers and doctors and accountants and actuaries and dentists and whatever. Eating well and exercising is something they might enjoy, but it's something that they do to help them live better, perform better in other areas of their life usually. Whereas a lot of times for a lot of us, we eat better and exercise to get better at exercising, right? I know when I was younger, like I was trying to get big and get strong. And so, I mean, so much of my life revolved around getting bigger and getting stronger. I exercised for the sake of exercising, not to help me do other life activities, but to help me actually get better at lifting. So, and I think a lot of fitness pros fall into the same category. And so we apply things that are working for us at that point in our life, in our career, these more advanced protocols to less advanced individuals, right, who won't see as much benefit from those protocols. So I think it's always important to keep in mind people who are coming to you with more general goals or who are much earlier on the path than you are, to start at fundamentals, right? Fundamentals first, always. So that's probably my kind of slides right into my second piece, which is focusing on the fundamentals, helping people focus on like how to eat slowly and mindfully with minimal distraction, learning to tune into their actual like hunger and appetite cues, so they can actually determine when they're satisfied, and paying attention to what we would call like an internal locus of control, which is like, am I actually satisfied from this? As opposed to using external factors like how much food is left on my plate relative to how much I put, or how much is the person next to me eating, which is actually how there's some really fascinating research, especially from Dr. Brian St-Pierre's lab. He has a great book called Mindless Eating that shares a lot of the research, and it's really easy read, and I highly recommend it, into all of the things that impact why people do what they do and why they eat as much as they do, because we don't pay attention to internal senses that tell us we've eaten enough. And it takes practice, and it takes intentional practice. You have to eat slowly to learn to actually tune into it. So learning on how you eat, then focusing on how much you eat, eating only until satisfied, and then focusing on what you're eating, making sure you're getting adequate protein, adequate fruits and vegetables, and getting some healthy fats mixed in, and a reasonable amount of carbs. Those are kind of like your bedrock principles, which can be applied to almost any eating style. You want to eat whole foods, plant-based? Cool. You can do that eating slowly, eating mindfully, still making sure you're getting plenty of protein, fruits and vegetables, healthy fats and carbs. You can do that whether you're eating paleo or whole food plant-based or even keto, right? So we teach fundamental principles that can be applied across virtually any dietary style. So I think that's kind of my take-home message. Apply the right things to the right people, and you have more advanced people, do more advanced protocols. And you have less advanced people, make sure they have mastered those fundamentals first and know what those fundamentals are. And I think it's eating slowly and mindfully, so focusing on how people eat, how much they eat, and what they eat. The timing, the when, that comes much further down the line.
Awesome, Brian.